Hello everyone, welcome back to my channel. So in this video we will be discussing about chronic gout drugs. Okay, the drugs which are used in chronic gout. So we have discussed that when a pain and stiffness it persists in a joint more and it between the attack, so gout has become chronic. Okay, other cardinal features are like hyperuricemia, toffee. Toffee are chalk-like stones which are present under skin of soft tissue like pinna, eyelid, nose, around joint, urate stone in the kidney. Okay, so chronic gout arthritis, it may progressive disability. It can cause progressive disability and permanent deformities. Okay, so there are two different type of drugs which are used. One is uricosauric agents. They inhibit the active tubular reabsorption of uric acid. Okay, in proximal, which increase the excretion of uric acid. अगर उसका एब्जॉर्प्शन कम कर दिया in the tubule, तो it will be excreted out in urine, right? So these two are probenecid or sulfenpyrazone. So these are two uricosauric agents. Okay, they are rapidly acting but they are poorly tolerated. Okay, they high fluid intake is advised to prevent the formation of urate crystal in urine. Okay, and sulfenpyrazone is an alternative to probenecid. Okay, after that we can use it. Uricosauric drug, they should not be given within 2-3 weeks of an acute attack of gout. Okay, first we will give the simple like NSAIDs and glucocorticoid and colchicine. After that we will give uricosauric agent, and these drugs are contraindicated in patient with renal failure. Side effects are rare, but GI toxicity, nausea, vomiting, skin rashes may occur. Now the drug interactions between like probenecid and beta-lactam antibiotic like penicillin and cephalosporin. I have uploaded a video about beta-lactam antibiotics. Please check them out if you are reading that. So these beta-lactam antibiotics, they are excreted by active tubular secretion. Okay, and when they are administered simultaneously with probenecid, they compete with penicillin and cephalosporin and they block the tubular secretion of beta-lactam antibiotic. And because of that, plasma level of this beta-lactam antibiotic and their durations of action increase, and thus the treatment become more effective. Okay, but probenecid should not be given during an acute attack of gout because like these are toffee which are deposited in the joint. Okay, if probenecid will act on it, it mobilizes the uric acid we have discussed. So in blood uric acid will come, so plasma urate levels, they are fluctuating, hyperuricemia can occur, and it can also again cause the number of acute attack, right? So uric acid synthesis inhibitors, these are the second drugs after these drugs. So like allopurinol. So allopurinol, it prevents the synthesis of uric acid by inhibiting the enzyme, which enzyme, that is xanthine oxidase. So hypoxanthine has been converted into xanthine, that will convert into uric acid. So for this conversion, the enzyme that has been used is xanthine oxidase. So these drugs, these are inhibiting the xanthine oxidase. That's why they are uric acid synthesis inhibitor, and it reduces the level of urate. Is allopurinol is का जो active metabolite है, that is alloxanthine. It is a non-competitive inhibitor of xanthine oxidase enzyme. It is more powerful as well. Okay, and it reduces the urate in the kidney, joint and soft tissue. There are increased level of hypoxanthine and xanthine. Agar hypoxanthine and xanthine are not converted into uric acid, they will be not excreted out. So they will be accumulated in the body, and they will the level are increased, and they will effectively excrete out in urine. Okay, in the form of hypoxanthine and xanthine only, not in uric acid. Okay, allopurinol, orally we can give it, and it is a drug of choice of asymptomatic gout. Okay, it is used in chronic gout as well as in hyperuricemia, which is associated with cancer, chemotherapy, renal diseases. It should not be treated within 3 weeks of an acute attack, and it may precipitate another attack. Okay, the adverse reactions are like hypersensitivity, skin rashes, itching, headache, fever, rarely Stevens-Jones syndrome, we will discuss about it later, GIT, nausea, vomiting, diarrhea, hepatotoxicity. It may also occur. Contraindications like children, pregnancy, lactating mother, patient with liver and kidney diseases. Okay, so we should not give them allopurinol, but when there are some drug interactions like allopurinol with 6-mercaptopurine. So 6-mercaptopurine has been converted into thiouric acid by the enzyme xanthine oxidase, that is being inhibited by allopurinol. So allopurinol is interfering in the metabolism of 6-mercaptopurine, right, by inhibiting the enzyme xanthine oxidase and increases effect. अगर फिर if we are giving allopurinol, तो अगर उसके साथ हमने 6-mercaptopurine भी दिया है, so we have to increase the dose of वी हैव टू डिक्रीज द डोज ऑफ 6 mercury of urine, क्योंकि उसका मेटाबॉलिज्म इट इज़ इनहिबिटिंग, तो इसके साथ दिया है तो इसके साथ हमें कम डोज में देना पड़ेगा देन यूजुअल, राइट. सो दिस क्वेश्चन हैज़ बीन आस्क्ड इन प्रीवियस. सो नाउ द अनदर ड्रग इज दैट इज Cybosocytostat. Xanthine oxidase inhibitor है ये भी. It decreases the formation of uric acid administered orally once daily dose is used for chronic gout. Adverse reaction include diarrhea, headache, hepatotoxicity. Phibostat can be used in gout in a patient which are intolerant to allopurinol, because allopurinol is the drug of choice of all kind of gout. Okay, and the last drug that has to be discussed is Rasburicase. It is a urate oxidase produced by recombinant technology. ये क्या करता है, you convert the uric acid into soluble allantoin. So this uric acid has been converted to allantoin, which is soluble by Rasburicase, and that is excreted in urine. It is that's why it is increasing degradation. Okay, right, it is degrading. So it is infused to decrease the serum uric acid level in children with leukemia or anti-cancer drug therapy. So that's all for this video. Thank you for watching, and please subscribe to my YouTube channel.